Video time. All right, welcome everyone to today's update on the novel coronavirus. With us is Dr. Dina Hinshaw, Chief Medical Officer of Alberta. She'll provide some brief opening remarks and then we'll open up the floor to questions either in person or on the phone. I'll now turn over to Dr. Hinshaw.
Great, thanks Tom. Good afternoon and thank you all for coming. As Tom said and as you know, my name is Dr. Dina Hinshaw, Chief Medical Officer of Health for Alberta. I'm here to provide another update on Alberta's preparations for novel coronavirus, also known as COVID-19. Over the last few days, there have been some significant developments occurring around the world. We're actively monitoring these developments and assessing the risk and any need for changing our approach to protect Albertans. There is still no confirmed or probable cases in our province, and the risk of Albertans catching COVID-19 in our province remains low at this time. However, with increasing spread around the world, it is even more likely that we will eventually see cases in Alberta. As new information becomes available, we are working with partners like the Public Health Agency of Canada to assess it and adjust our public health approach accordingly. Effective today, we will be recommending that anyone who has visited Iran in the last 14 days should voluntarily isolate themselves until 2 weeks have passed since their visit, even if they are feeling well. Anyone in Alberta who has returned from Iran in the last 14 days should call HealthLink at 811 to get information about self-isolation and these recommendations. This is the second group of returning travelers we are asking to self-isolate. Self-isolation means staying home. It means avoiding work, school, social events, or other public gatherings. We expect only a very small number of people will need to isolate themselves. This is a new step and one we do not take lightly. We are following the approach that is being adopted across Canada, and we are acting out of an abundance of caution, which has been Alberta's approach all along. All other public health measures will remain in place. We continue to advise returning travelers from Hubei province, China, to self-isolate for 14 days since leaving Hubei. Travelers from mainland China, Hong Kong, Singapore, South Korea, Japan, and Italy are asked to monitor their symptoms for 14 days after returning. If they begin to feel ill, they should immediately self-isolate and call HealthLink. The recent developments in the United States are also concerning, with community transmission of COVID-19 identified in Washington state. No specific measures are being recommended in Alberta at this time in response to that information, but we are working closely with the Public Health Agency of Canada to assess this emerging situation, and if additional steps are needed, we will take them. As this global outbreak continues to unfold, I continue to remind Albertans that there are ways to protect yourself and those around you. If you are planning travel to other parts of the world, please check the latest travel advice from the Public Health Agency of Canada before leaving. This is a rapidly evolving situation. Advice can change quickly as new information becomes available. I continue to urge Albertans to practice good hygiene habits, like staying home when sick and covering coughs and sneezes to protect others. It may seem odd or simple that regularly washing hands and avoiding touching your face with dirty hands can protect you from a serious illness, but it works and there's evidence to prove it. If you are feeling sick, it is also really important that you not visit loved ones in hospitals or long-term care facilities, as people in these locations are at the highest risk of complications from influenza and other respiratory viruses. We are now in the third month since COVID-19 emerged. I know that some Albertans may feel fatigued or wonder what comes next. It's important to remember that outbreaks like COVID-19 take time to unfold. New cases will continue to be confirmed around the world, and additional evidence will emerge in the weeks ahead. We will continue to work behind the scenes to ensure the health system is prepared to respond whenever the virus should come to Alberta, and we will keep working with the rest of Canada to monitor what is happening worldwide and to assess the health risks here at home. If additional steps are needed in the future, we will take them. Our top priority is protecting the health and well-being of Albertans. Thank you again for coming, and I'm happy to take any questions.
What is the tipping point that got you to where you are with your decision on Iran today?
So this was a decision that was taken in collaboration with the Public Health Agency of Canada and other provinces and territories. And it was driven in part because most of the most recent cases in Canada have been identified in returning travelers from Iran. And also, as we see the situation in Iran unfold, we are concerned that there is community spread at a quite high rate in that country. So those are the reasons that we're taking this measure.
So it's a reactionary situation to what's happening there. At what point will we have to become proactive in decisions like this?
So we know that asking people to stay at home for 2 weeks has a serious impact on them and those around them. So again, it's a decision we don't take lightly, and it's one that we are using the best available evidence to make that particular recommendation. You'll note that last week we did expand our testing for returning travelers to multiple countries of concern. So we are trying to use the best available evidence with a balance of risk and the burdens that we're asking people to bear to protect our population and also to make sure that we catch infections if they should come from out of the country.
How comfortable are you with our testing process, and is there anything different you're looking at doing, or are you happy with the way things are right now?
So our testing process is focused on those who have the highest risk of having been exposed to the virus that causes COVID-19. I will note that we have completed 173 tests, all of which were negative, and the vast majority of those were positive for another virus like influenza. So I want to remind people that we are doing many tests in those who are at highest risk, and all of those so far have been negative. In terms of other approaches we may take, we certainly are looking closely at what has happened in Washington State and considering the need to potentially expand our testing to look at cases who have not traveled in order to provide an extra layer of protection and security that we would detect cases quite quickly. But again, I think our current focus on those at highest risk has yielded no positive cases. And I'm confident that, again, we are catching those at highest risk, but also wanting to make sure, as has always been our approach, that we're acting out of an abundance of caution. So we are looking at the possibility of expanding testing at some point in the future.
How challenging has it been to sort of weed out the rumors that are going on online? I think the latest one I saw was there was a confirmed case in Red Deer. How inundated are you with these rumors of confirmed cases?
So whenever there's something new and people are worried, they want the latest information. And unfortunately, sometimes people seize on rumors as truth. So we are, seeing that some of these things pop up here and there. I think the important thing to remember, and again, we're asking you as our partners in this, media are key partners, to try to get the word out that getting information from reliable sources is a key way of helping our response, because the more people respond to rumors or innuendo, the more difficult it is to make sure they have reliable information to prepare. So again, it's a constant, something we're constantly aware of, but I would say that we are working on a social media presence. We're working to have a regular web presence and working with partners to try to get the reliable information out in as many channels as possible.
With March break right around the corner, do you have any recommendations for parents and kids? Do you advise them to stay put, or they can go and travel?
It's a really good question because, as I said earlier, the situation is evolving rapidly. The best advice I can give is to watch the Public Health Agency of Canada travel recommendations closely to see if a destination that someone's planning on traveling to is impacted. And wherever anyone is traveling around the world, all of the recommendations we give about regular hand washing, keeping hands away from faces, if you're in a public place, thinking about areas that might be touched a lot and maybe carrying some wipes that you can wipe off seat handles and things like that. All of those things are things that people can do whether they're at home or on holidays. And then when they come back from holidays, again, kind of checking the information to see if they may have been exposed while they were traveling, then they would need to take the same precautions that we're recommending for anyone else. But again, right now, we can't predict exactly what will happen, so they just have to make decisions based on the best current information.
Operator, could we patch in the first question on the phone?
First question is from Brittany Gervais with the St. Albert Gazette. Brittany, your line is open.
Hello. With the global shortage now of face masks, are there any concerns the increased demand will impact the province's healthcare providers and their supply?
So again, a good question. We're looking closely at the supply of personal protective equipment, and I think it's important to underline that personal protective equipment is face masks, eye shields, gowns, and gloves in healthcare environments. So just underlining that point that masks alone are only one part of a broader system of protection. We're working with Alberta Health Services to ensure that we have an understanding of the supply they have available right now. Alberta Health Services did order quite early some extra supplies to add to their stockpile, so that's helping. We're also working closely with the federal government and other provinces and territories on collaborating with orders for personal protective equipment. So at the moment, we have robust stock in the health system, and we are working to make sure that we mitigate any risk that could be threatened.
Operator, could you patch in the next question?
Yes, the next question is from Jennifer Lee with the CBC. Jennifer, your line is open.
Hi, thanks for taking my call. I'm wondering, just now that you've expanded the recommendations for self-isolation to those returning from Iran, do you have a sense of how many people you expect this to impact?
So what we understand from the federal government is that there are approximately 700 people coming in per week across the country who've been to Iran. We know that the bulk of those travelers are going to provinces other than Alberta. So in Alberta, I anticipate it would be a fairly small number.
And can I just follow up in terms of your personal concern level, given what you're seeing with the increased cases in other provinces here and what's going on in the U.S. With the number of deaths? I guess what would your messaging be to Albertans? Has this changed your concern level about what we could see?
So I think what we're seeing unfold over the last several days really underlines the messages that I've been giving over the last couple of weeks about the need for preparedness and the need for businesses and communities in Alberta to think about how they would respond if we were to have a case of the virus come to Alberta, and if that spread. I think in Canada, what we've seen is the cases that have been identified have been in travelers who've been returning from other places. We've been able to identify them, identify their close contacts, and have their close contacts quarantined to be able to prevent any further spread. So I think the important thing to remember is that currently in Alberta, with no probable or confirmed cases, the risk of exposure in this province is low. However, with the developments around the world, I think the risk of the virus coming to Alberta remains quite high. And we are ready for that to happen. We have been preparing the health system and again advising Albertans to build these habits like regular hand washing, staying home when sick, making plans to if someone is sick with a fever and cough, which is most likely influenza, we would want them to stay at home, even if that happened right now. So again, thinking about how you can make plans to keep yourself home if you have young children, how they can stay home when they're sick. Those are the kinds of things that people can do to prepare.
We'll take one more on the phone, and then we'll go back to the room.
Next question is Robert Tuttle with Bloomberg News. Robert, your line's open.
Yeah, hi. I was just wondering if you had made any asked or advised companies to take any steps like, given the international workforce you have in this province, have you asked them to take any steps maybe to allow workers to work from home or other things to prevent possible cases?
So what we've done is we've put some resources on our website under an employers section that would be good resources for businesses and employers to use as they're thinking about what they might do, again, if we had the virus in the province. So that would include everything from how would they assess any risk to their workers and protect workers, how would they limit the risk of spread in whatever workplace they have, and how would they ensure business continuity if they were to have employees who were sick. And so I would recommend that employers and businesses check out the links on our website and go through some of the resources that we've posted there to work through some of the things they might need to face, again, if we did have the virus come to Alberta and spread.
Yep.
On that same question, do you have a good understanding of how prepared businesses are? Are they actively reaching out, and are they finding the answers they need?
So certainly we've had questions for some businesses. I think that different businesses would have different contacts, and not all of them would need to contact the Ministry of Health. So I, again, think that businesses in general are aware of the situation, and we're encouraging them to get reliable information, again, from our website, or I know there's other resources out there for business continuity planning. So I wouldn't be able to say, I don't think my awareness would be a good gauge of how prepared our businesses are, because, again, they have many resources to be able to plan and prepare. So my job is to remind all businesses to think of this if they haven't already, and also to make sure that we're posting resources that are reliable, that they can use.
Any additional questions in the room?
Just back to the Iran situation again, because of the plane crash that happened and the close connection with Alberta and Edmontonians, are you seeing more travel back and forth between the two countries?
So again, I think, you know, the numbers I have are the numbers that we have federally, which again are about 700 a week. So it would be difficult for me to say if the tragic events of the plane crash have changed the situation in terms of returning travelers. But what I can say is that the majority of returning travelers are going to other provinces. So again, we expect the number of people to be impacted by this in Alberta to be quite low. But we still want to make this recommendation and again offer that support through HealthLink for any travelers who've returned in the last 14 days.
Take operator, one more from the phone. Operator, is that
again? We have Jennifer Lee again from CBC.
Hi. Hi. Thanks. I'm just wondering, given some of the changes we've seen over the last few days that you mentioned, are efforts being stepped up in terms of preparations in hospitals, nursing homes, given that we're seeing cases of death in Washington State in nursing homes, in terms of preparing for the virus should it arrive here? And I'm thinking also specifically about isolation centers and that kind of thing. I know you've referenced work being done in that respect in the past. Can you speak to that?
Sure. So I would reiterate that ever since we learned of the new virus and saw that it was starting to circulate more widely in China, we have been working with the health system and across all of government since late January to look at our pandemic plans, knowing that this particular virus is not identical to influenza, but using our pandemic planning to make sure that we were getting ready if this virus should continue to spread. So again, built on that foundation, we've been working for many, many weeks now to make sure that our health system is ready, that we have plans in place if we should need to open assessment centers to deal with increased volumes of testing. And certainly messaging to long-term care facilities has been a part of that. So we did send a message last week to long-term care facilities and home care providers specifically with some information about the things they need to consider and how they can be ready. And again, our planning does continue. We're identifying areas that we want to do some little extra planning on, but that's all building on a really solid foundation. And so it's just a matter of using every bit of time that we have to be as prepared as we can.
Any final questions? All right, thanks for coming, guys. If you have any follow-up, just reach out to me, Tom McMillan, and I can track down the information for you.
Thanks very much.